Hello guys and welcome to MEDVERSE, and today we are going to start with let's say heat injuries, right? So starting off with heat injuries, if we start with another part of traumatology, right? So whenever you are talking about heat injuries, look at this. Heat can have two type of effects, right? Sorry, general effects and local effects. So general effects basically systemic effects which occur throughout the body. Local effects occur at a particular area of a body, right? General effects, heat related syndromes we have, right? Heat cramps, heat syncope, and heat stroke, right? Heat cramps, heat syncope, and heat stroke. Then local effects can be classified into effects due to dry heat, like flame or fire. Dry heat is flame or fire. We can have burns, right? And moist heat we can have like exposure to hot liquids and steam. We can have scalds, 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 burns and scalds. Okay, first we'll discuss about the general effects of heat, right? The general effects of heat. First one is the heat cramps, also known as miner's cramps, also known as fireman cramps or stroker's cramps, right? Heat, miner, fireman, and stroker. What is the pathophysiology? Due to sweating, there is a loss of sodium and potassium, where sodium predominates, right? We can have involuntary muscle spasms. Okay, the muscle spasms are there due to loss of sodium and potassium due to excessive heat, sweating, or diaphoresis. But remember here there is a no you can say defect in thermoregulation mechanism. There is no defect in body core temperature. Then heat syncope or heat collapse. Due to profuse sweating, what happens is that this sodium loss is occurring, right? In heat cramps, sodium loss is occurring. But in heat syncope or heat collapse, what is occurring is that this sodium drags water along with it. Okay, so sodium and water loss. This water loss will decrease the basically BP, decrease the volume, blood volume. Okay, BP and blood volume, wherever it decreases, the patient lands into a state of shock. Okay, hypovolemic shock. So dizziness or syncope may occur, and here also thermoregulation and body core temperature is normal. The last one is the most dangerous one, the heat stroke, also known as sunstroke, also known as thermic fever, also known as heat hyperpyrexia. Okay, many names: heat stroke, sunstroke, you must have heard, thermic fever, or heat hyperpyrexia. Hyperpyrexia means a aggravated state of fever. Okay, here there is a triad. Triad is that first brain is at top, right? Brain dysfunction, body temperature dysfunction like more than 40.5 degrees Celsius, and history of heat exposure must be there. Okay, this is a triad of heat stroke: CNS dysfunction, body core temperature more than 40.5, and history of heat exposure. Heart rate increases, BP decreases. Okay, there is an increased heart rate, decreased BP, and the skin becomes dry and sweating is absent. There is a complete absence of sweating. This is a very special point. But in exertional type of heat stroke, there is increased sweating or diaphoresis. Okay, so there is a variant of heat stroke that is called exertional heat stroke, that is diaphoresis. And here the thermoregulation is impaired, the thermoregulation mechanism, okay, this is impaired, and there is a increase in body core temperature more than 40.5, which you already know from the triad, right? If you do autopsy, they will get post-mortem caloricity. Body is warm even after death. Usually there is a loss of body heat, right, with death. But here you will get post-mortem caloricity. Body is warm even after death. Let's come to dry heat. Exposure to fire. What happens in fire exposure? Burns, obviously. If there is a 5 to 6 hours exposure to 44 degrees Celsius, we can get burns. But 65 degrees Celsius, we are increasing the temperature by about 21 degrees Celsius. So 2-second exposure can cause burns. Okay, you can see the difference, abrupt difference. Even 2-second exposure to 65 degrees Celsius can cause burns. What is the classification? We have three classifications. The most common one is the modern classification. Of course, modern is the most accepted one, should be the most accepted one. Okay, Dupuytren's classification, which has 6 degrees of burn. Then Wilson's classification, 3 degrees of burn. And modern classification has also you can say 1 2 3 4 5, okay, 5 degrees, but usually write up to 4 because second degree is classified into superficial, partial and deep partial. Very easy, just pay attention to this table. It's not difficult as it looks. Look at this. First degree burn. First degree, remember, whenever we are moving down, the severity is increasing. Severity is increasing as we are moving down. First degree burns only involves epidermis. Okay, there is only redness. Pain will be there, yes, pain will be there. Scarring will be there, no. Heals in less than 1 week. So first degree only epidermis is you can say burnt. Okay, there is only redness, nothing blisters, nothing. Pain will be there, no scarring, and heals in less than 1 week. Okay, nothing more serious. Second degree is the superficial partial. Okay, remember we have dermis. One is the papillary dermis like this, and second one is the reticular dermis. Papillary dermis, reticular dermis. So if it is involving up to papillary dermis, epidermis will be involved obviously as it is second degree, so must involve the first degree. Epidermis plus papillary dermis. So epidermis plus papillary dermis, there will be blisters here. Redness will be there, but blisters will be there. Pain will be there obviously. Scarring won't be there. Unusual, it may be, may not be. You can consider this negligible. And heals in a bit more time, obviously 1 to 3 weeks, right? Second degree, I told you, deep partial. Deep partial means both the dermis will be involved. Papillary dermis, reticular dermis, both dermis involved. Epidermis plus both dermis, right? Blisters will be there, no redness. Redness is absent. Okay, here pain won't be there. The most characteristic feature is that pain won't be there, but there will be scarring. Okay, if epidermis and complete dermis is burnt, okay, you can say the nerve endings are damaged. If the nerve endings are damaged, there won't be pain, but scarring will be there. There will be heavy scarring due to blisters, and healing takes more time, more than 3 weeks or 21 days. The third degree is the full thickness burn, where epidermis is burnt, dermis will be burnt, okay, and dermal appendages will be burnt. Okay, dermal appendages also. Here there will be blackening and charring. Okay, you can see here the third degree burn. This is a full thickness third degree burn. There is blackening and charring of skin. Okay, due to dry heat, what happens is charring occurs. So blackening and charring of skin. Obviously there won't be pain. Why there won't be pain? Because the nerve endings have already been damaged. Okay, and scarring will be there. Of course, blackening is there, charring is there, so scar will be present. But negative is what? There won't be healing. Okay, we don't have any particular timeline for healing, and this is you can consider is irreversible. Fourth degree, fascia, muscles and bones all are burnt. Okay, you can go at as much that depth you want. Okay, epidermis burnt, dermis burnt, then hypodermis, fascia, superficial and deep, muscles, bones. It can go up to bones even. Complete charring will occur. No pain, a scar will be there obviously, and healing we don't have timeline. So I believe that this table is very easy. Pain occurs only due to only up to second degree superficial partial burns. From second degree deep partial, there won't be pain. You can consider scarring. There will be positive from where pain absent, scarring present. Pain present, scarring absent. You can consider it like this. And timeline less than 1, 1 to 3, more than 3. Very easy. Here epidermis plus papillary dermis, complete dermis, dermal appendages, fascia, muscle, bones. Okay. Here only redness. Blisters start from here. Blisters end here. Blackening and charring and complete charring. Very easy. You can just use a common sense and say. First degree you can see this. Okay. Only redness. Second degree you can see blister is there, and third degree you can see complete charring. This is third degree full thickness burn. Okay, third degree full thickness. Okay, estimation of burn surface area. How much area is burnt? We have to estimate it, and for this we have rule of Wallace, which is the rule of 9. This is a very common question in your university as well as NEET PG. Learned and Broader's chart for children less than 15 years. Rule of palm, if size of burnt area size of palm, then you consider this 1%. Means if a area is burnt and if this is same as your size of palm size, if this is same as palm size, this is considered as 1%. Okay, so if there is a burn of palm size, you can consider this 1% area of your skin is burnt. Okay. Okay, so starting off with rule of 9, look at this. We consider it head and neck total is 9%. Head and neck total is 9% of body area. So front side is 4.5%, back side is 4.5%. Okay, equal. You can divide it front and back, very easy. This neck part 1 plus 1% means that here front part is 1%, back part is 1%. Chest can be divided into two parts. Front is 9%, back is also 9%. Okay, so you can divide it in 9% to 4.5, one part, second part, this is first part, this is second part. You can divide it along with 4.5, this is also 4.5. Okay, upper limbs 9% each. Okay, upper limbs is 9% each. So this upper limb is 9% total. 9% total. So total, this is total. So front part of one limb is 4.5. Back part of one limb is 4.5. Total is 9. Similarly, this total is 9%. Front part of this is 4.5. Back part of this is also 4.5. Very easy. Okay, this is that. Here how it is distributed, this part, this arm part is 4%, 4 3 2. It is distributed like this, 4 3 2. So 4% means this whole part is 4%. So front will be 2%, back will be 2%, back of arm will be 2%. You can arm to shoulder, you can consider this area. Forearm similarly 3% total. So this front part of one forearm is 1.5. This is also 1.5. This hand is basically 2%. So front part of hand is 1%, back part of hand is 1%. Are you understanding? Okay. Trunk 36% total. So front part of trunk will be 18%, back part will be 18%. Okay. And this part is 10%. This part is genitalia is 1%. So 0.5, 0.5. Okay, negligible. Lower limbs 18% each. Lower limb is 18% each. Okay, so 18% total. So this lower limb is 9%. This is 9%. Back part similarly 9%, and this is 9%. Okay, and how it is distributed? This thigh area, this you can say lower distal leg area, and this is our foot. Okay, so this part is 10, this is 5, this is 3 in total. 5 10 3 18. Okay, 18%. So this part will be 5, this will be 5, this will be 2.5, this will be 2.5, this will be 1.5, this will be 1.5. Okay, so this is a very hectic calculation, but if you understand it, very easy. Okay. Okay, then in a child, this part is 18%. Okay, this was 9% here, head and neck, but here it is 18%, a double. And this leg part is 13.5%. Child calculation they won't ask you in props. Cause of death in burns. Okay, advice that please solve problems on that. Okay, some books and guides give you problems on this concept. So if you are targeting INI or NEET PG, then please do practice this problems on that, right? Cause of death in burns. Why there is death in burns? Instantaneous death. Okay, so we have a timeline here. Death may occur instantaneously, death may occur within 1 day, death may occur within 2 days, okay, 3 days or more, or there may be a delay in death after few years. Okay, look at this cause of death. So if death is occurring instantaneously, if a patient is in a building and there is a fire in the building and the person dies instantaneously, then what might have happened? You can suspect laryngeal stridor. Okay, laryngeal stridor. Laryngeal stridor is the most common cause of death in instantaneously in burns. Okay, or you can have CO poisoning. The fumes are emitted. These fumes These are very poisonous fumes of carbon monoxide. As there is the depletion in oxygen, the oxygen is partially combining with carbon and forming carbon monoxide. The partial combustion, and CO has a very high affinity, about 200 times more affinity, okay, to blood, and this affinity is basically causing carbon monoxide poisoning, or there may be neurogenic shock. Okay, laryngeal stridor, CO poisoning, neurogenic shock, instantaneous death. Done. Death within 1 day. If there is a death within 1 or 2 days, then you can expect shock. Okay, shock takes time to set because many mediators are there of shock. Shock is a completely different discussion in surgery. I may take any other day. So if it is occurring within 1 or 2 days, then the most common cause is shock. If the person is taking 3 days, there may be secondary bacterial infection. The bacteria may get inside and cause septicemia. Septicemia. And the person may die due to septicemic shock. Septicemic shock. Okay. After few years, if it is occurring after few years, then a very famous name is asked very commonly in Viva, Marjolin's ulcer. Marjolin's ulcer. Marjolin's ulcer is a malignancy developing in the burn scar. Okay, is taking years. If there is a burn, there is a scar. If there is scarring, where there is scarring, there is scarring where there is no pain. Where? Third, fourth, okay, third degree, fourth degree burns. In this, what happens is in the burn scar, the malignant cells start multiplying and cause a malignancy. Look at this. This is very you can say irregular looking. It's a malignancy for sure. Okay, it's a spot diagnosis. Marjolin's ulcer. And if the patient has a history of burns, okay, and this type of picture, then obviously Marjolin's ulcer. There's no DD. Autopsy finding. What are the autopsy finding? Charred body. Obviously, if there is a death, then there must be complete charring. No algor mortis, no livor mortis, no rigor mortis. Okay, it's a situation in which all our autopsy features of normal death, okay, basically that is not there. No algor mortis, no livor mortis, no rigor mortis. Okay, we have a crow feet sign. Crow feet sign. Okay, like the feet of a crow. Must have drawn a crow. Okay, so the feet is like this, right? Pardon my drawing. Look at this. Similar. Sparing of wrinkles, no soot deposition present. If this is seen, person was alive at the time of burning and victim was closing his or her eye. Okay, what happens that this crow feet sign is a very important sign. Medico-legal importance is very much of this sign. What happens is that if the person is alive at the time of burning, if the person is dead, let's consider one situation, person was dead, then eye is already closed, there won't be any wrinkles here. But if there is a live person, if there is a alive person and the fire is set off, or you can say homicidal tendency, or you can say any accident, a fire accident, what happens is that in the wrinkles there is no soot deposition. You can see there are clear areas here. Okay, I have annotated this. Look at this. This is a clear area. Just a minute. This is a clear area. This is a clear area. This is a clear area. You can see in the wrinkle part there is clear areas, and this area, this dark area, is the areas of soot deposition. Soot deposition. Okay. So there is no soot deposition present and the sparing of wrinkles is occurring, and this is called as crow feet sign. Okay. Crow feet sign understood? Okay, and this implies that the victim was alive at the time of burning. Examination of burns, non-specific findings, heat artifacts. We will discuss heat artifacts. Specific finding, characteristic of ante-mortem burns. Okay, characteristic of ante-mortem burns. What happens is that, look at this. A person is died. You just want to understand this. You can say concept that inflammation occurs in a alive person only, because obviously a mechanism is going inside your body. Can it occur inside a dead person? No. So whenever there is a blister, if there is inflammatory fluid present, protein and chloride rich inflammatory fluid present, then obviously inflammation has occurred. Okay, this base will be red erythematous. This is a red base. Inflammation, there will be reddening, there will be heat, calor. Okay, calor you can't appreciate here, but you can see the inflammatory fluid, right? You can if you puncture the blister, then inflammatory fluid will ooze out. Okay, that means that the person was alive. The person was alive at the time of burning. So that means that it's an antemortem blister. Okay, and what is a postmortem blister? You can see there is non-erythematous skin. The skin is not red. There is a gas-filled blister only, gas. That means that no inflammation. This is a post-mortem blister. Okay. So antemortem burns, inflammation and healing will be present. Granulation tissue will be present. Redness will be present. Okay. So you can remember the features of antemortem burns by the mnemonic FIRE. F-I-R-E. Fire. Fire is fluid in blisters. There is fluid in blisters. There are inflammatory signs like redness, erythema. Okay. Redness, red line, repair, all of these signs, and enzymes will be increased. That is, as a increased protein content. Increased protein content. So fire is the features of antemortem burns. Antemortem burns. Okay. Fluid in blisters, inflammatory sign, redness, and enzymes increase. Okay. Now we'll discuss some internal findings. Okay. 4C of antemortem burns. So if you want to know that a burn is antemortem and postmortem, then you have to understand the 4 C's. Okay. Look at this. This is our trachea. This is our bronch. Okay. Bronchioles may be there. This is the lung. So I am talking that if there is a deposition of carbon particles along the airways, which means that the person was alive, and the person has taken in some air. Okay, the person has taken in the poisonous fumes. So soot particles have deposited over airways. If a dead person is there, then how will soot particles reach his airways? If he can't take, right, he can't take the fumes, right? So carbon particles or soot is along the airways, then the person was alive. So it's a antemortem burn. Person was breathing at the time of fire. Okay. Now in the blood, if there is a increased carboxyhemoglobin is carbon dioxide along with the hemoglobin combination. So how will the carbon dioxide reach to the vessels if the person is breathing, if there is a respiration going on? If there is respiration, then there is circulation. If there is circulation, then carboxyhemoglobin will be increased. That is more than 10 gram percentage. So the person was alive at the time of burning. If there is a increased cyanide in blood, then obviously antemortem burn. Okay, this carbon dioxide and this all react to form cyanide. If there is a curling ulcer, that is stress ulcer in burns patient. Okay, there are some stress ulcers in burns patient. It's called curling ulcer. We have something called Cushing ulcers also. Cushing ulcers, and here we have curling ulcers. These are characteristic of antemortem burns. 4C carbon particles, carboxyhemoglobin, cyanide, and curling ulcer. Now, then we come to scalds. Scalds are due to moist heat. Scalds are due to moist heat, and this is due to immersion in hot liquids, due to steam exposure or hot liquid exposure. Okay, scalds may be there, and you can consider this burns. This is due to fire. Scalds is due to hot liquid or steam. Okay, charring will be there in burns. There won't be there in scalds. Scalds you cannot get a blackening or charring due to scalds, right? Soddening and bleaching of skin will be there in scalds. Okay, you can remember like this. Bleaching is basically water-based event, right? So bleaching is due to scalds. Lines of blister will be absent. There are blisters at any point, but in scalds the hot liquid is flowing, right? Liquid is flowing, so there will be blister in the position, in the direction in which the water flowed over the body. So lines of blister will be present. Splashing is absent, obviously. Present in hot liquid or steam. Okay, present in scars. Clothing will be burnt here. This will be intact. Okay. Level of contact, seen at or above the level of contact. This is seen at or below level of contact. Look at this. Basically what is happening is that you get fire. You get fire, right? This is fire. Let's consider it fire. Fire will release fumes above. Okay, so if the person is above, then the point of contact is above the you can say the level of heat or hotness. Okay, the burn is above the level, but water follows gravity, so water will flow down. And the water is flowing down, the liquids tend to go down. Okay, so there will be below the level. Okay, so level of contact is below the level of contact, and this is above the level of contact. Okay, so causes fire, this is water. Then charring will be there in which part? Burns, obviously. Scalds won't be. Soddening and bleaching in scalds. Splashing, scalds. Okay, S for S, you can remember like this. S for S. Lines, S, again S, lines, LINES. So it will be present in scalds. Soddening, again S, scalds. Okay, the only S that is not there in scalds is singeing. Okay, singeing or charring is basically in this burns. Clothing will be burnt in, obviously dry heat will burn your cloth, but it won't be burned in moisture. Level of contact is above, this is below due to gravity. Another thing is that hyperthermia anhydrosis. Okay, hyperthermia anhydrosis or desert syndrome. Desert syndrome is basically sweating is absent in all parts except head and neck. Okay, and there will be hyperkeratotic plugging of sweat gland, papular rash in US soldiers training in deserts. In US, what happens is that the soldiers train the you can say trenches are there. Okay, in deserts, so they are trained for extreme activities. So US soldiers are trained in deserts, so the name is desert syndrome. There is sweating absent in all parts except head and neck. Only there is head and neck sweating and absent in all the parts, but the sweat glands are plugged by hyperkeratotic material. The keratin is breakdown, and this keratin plugs are basically plugging the sweat gland. So sweat gland is, you can say, is blocked, so there is no sweating over the body. There is only sweating over head and neck, and there will be rash over face and neck seen in US soldiers. Hyperthermia anhydrosis. Okay, so this completes our heat injuries. Heat artifacts, non-specific findings. We have 4 heat artifacts: heat stiffening, heat rupture, heat hematoma, and heat fracture. Okay, heat stiffening, heat rupture, heat hematoma, and heat fracture. So SRHF: stiffening, rupture, hematoma, fracture. Heat stiffening. What is heat stiffening? If a muscle is exposed to heat more than 65 degrees Celsius, we told you in previous section that if a person is exposed to 65 degrees Celsius heat for 2 seconds, then burns can occur. If the muscle is exposed to heat more than 65 degrees Celsius, the muscle proteins are basically coagulated. So there is a coagulation of muscle proteins, and muscle becomes stiff. This attitude is there, this type of position is there, like a boxer. So this is called pugilistic attitude, boxer's attitude, fencer's attitude, or defense attitude. Okay, so we have this type of thing, claw finger. Okay, clawing of finger, the person will make claws, clawing of fingers. There will be clawing of fingers. Legs flexed, arms flexed. Okay, and there is a opisthotonous position. Opisthotonous position you get in tetanus, right? Rhizus sardonicus, opisthotonus, all of this. So there also, here also there is a opisthotonus position due to contraction of paraspinal muscles. Okay, the contraction of backside muscles, basically the latissimus dorsi and the paraspinal muscles. There's a you can say contraction due to muscle protein coagulation. And opisthotonus position, the person is lifted up like this. The person head is there, the leg is there like this, and person is lifted up. Okay, like you see in ghost movies, right? That type of thing. Opisthotonus position. Legs flexed, knee and hip, arms flexed at elbow, clawed fingers, and muscle have become stiff. This is called pugilistic attitude or boxer's attitude or fencer's attitude or defense attitude. Okay, this is about heat stiffening. Heat rupture. What is heat rupture? Due to heat exposure, there is an intense drying of skin. There is a drying. Okay, rupture. Basically, you can get you know, in winters the lips get ruptured, right, due to drying of skin. So if there is a drying, it can get ruptured. Okay, this is the main trick which you can remember. So heat exposure, intense drying, skin splits or ruptures. Okay, nerves and vessels are intact. There is no sensory loss, there is no motor loss, all things are intact, but there is a splitting of skin and a rupture of skin. Splitting and rupture of skin, like this. Okay, usually seen over fleshy parts of body like calves, thighs, joints, on the head. Okay, basically over fleshy parts, buttocks, calves, thighs, joints. Okay, and it resembles incised wounds. Very special point. Incised wounds you have read in traumatology. Okay, it resembles incised wounds. How to differentiate? Incised wound is small, heat ruptures are very large because there is a rupture due to intense drying due to heat. Margins are regular. Here it is irregular. Incised wound has a regular margin like this. Heat rupture have a irregular margin like this. Okay. In the floor, the nerves and vessels are cut due to incised wound, due to, let's say, a blade, something. Okay, if the incised wound is there, there is a chopping. Okay, there is a chop. So the nerves and vessels are basically cut here. So size is small here and heat rupture is large. Margins are regular here and irregular here. Floor, nerves and vessels are cut because in incised wound there is a chopping of nerves and vessels, and here the nerves and vessels are intact. Okay, there is bleeding in incised wounds. Obviously there won't be bleeding in heat rupture because everything is broken down, right? Due to heat there is a intense you can say drying. Inflammatory reaction is present here. Here it is absent. Okay, so this is about incised wound and heat rupture. Okay, you can comment about size, you can comment about margins, about the floor, or bleeding and inflammatory reaction, right? Starting off with heat hematoma. So we completed heat rupture and heat stiffening. We'll start with heat hematoma. Normally resembles extradural hemorrhage. Okay, outside the dura there is hemorrhage like this. You have read in regional injuries chapter. So heat hematoma resembles extradural hematoma or extradural hemorrhage. What is happening? Heat is there. Prolonged heat. Due to prolonged heat, there is a rupture of emissary veins. You have seen, right, between two layers of there we have veins like this, emissary veins. Due to heat, there is a rupture of this emissary veins, due to which blood comes out of dura. So outside the dura we have a hematoma forming. This is extradural hematoma. So how to differentiate between heat hematoma versus extradural hematoma? Heat hematoma is seen diffusely because heat won't see if it is the right side of the skull or if it is the left side of the skull, right? It is bilateral, diffuse bilateral. Okay. Extradural hematoma, it is a traumatic event, right? If it is a traumatic event, then in the site of trauma, if you fell down in this direction, if you fell down in the right direction, then there will be formation of EDH in right side. Okay. Unilateral on side of head and unilateral. Then about the color, it's a chocolate brown color. Heat hematoma is a chocolate brown colored thing. Okay. EDH, while it's a reddish purple type of thing, but this is, you can say, subjective. It appears to some autopsy surgeon and he just put a statement over here. This color you can usually see. Okay, all of this thing you will see, it will be reddish and brownish even. This is a honeycomb appearance due to bubbles of steam. Okay, there's a honeycomb appearance due to bubbles of steam. There's no honeycomb here. And increase carboxyhemoglobin level obviously in blood, the normal carboxyhemoglobin level. Okay, so heat hematoma and EDH you can differentiate basically by site. Site is basically bilateral in heat hematoma, unilateral in EDH. You can differentiate by color. So it is basically brownish in heat hematoma, reddish purple in EDH. You can differentiate by appearance, the honeycomb and non-honeycomb, and in blood levels. Blood levels, carboxyhemoglobin and normal carboxyhemoglobin levels. This is a heat hematoma in the parieto-occipital region. You can see here. Okay, look at this. Look at this. This is a heat hematoma. Most common site is parieto-occipital region. Parieto-occipital region. Last artifact is heat fracture. Due to intense drying of bones, these bones are exposed to intense heat, and there is a fracture lines that are present over bones, and there is a bone fracture. Can be present over skull or over long bones. Due to heat, what happens is that our cranium is a closed box. Okay, so there is a increased intracranial tension or increased intracranial pressure, you can say, due to steam inside the person. The intracranial tension or intracranial pressure increases, and we have sutures, right, separating the skull bones. The pressure will try to separate the skull bones. And this will cause the fractures in the skull. Okay, due to increased intracranial steam pressure, it will separate the sutures. And due to rapid drying and contraction, it is a you can say instantaneously there's drying, there's cooling. Okay, so rapid drying and contraction of bone will cause multiple fracture line from a point. Okay, due to multiple fracture lines will start from one point. Okay, and this appears like a spider spider web fracture, or spider web fracture, or stellate fracture, usually over temporal bone. Look at this. Here we have the starting point, and here the fracture line is going over like this. Okay, this is a stellate fracture or a spider web fracture, which is a heat fracture of the skull. Okay, this is about the skull fractures. The last part of this chapter is about bone fracture, the long bone fracture. The long bone fracture, due to increased heat, there is a shrinkage of muscle, and this muscle shrinkage will cause increased pull on the bones. Look at this. The bone is attached to muscle. Here the increased heat, just a minute it went. So this muscle, if they are exposed to increased heat, okay, this will contract, this will pull, and this, if it is pulling, okay, there is increased pulling, then there is a fracture over here, fracture of long bone due to increased pulling, due to shrinkage of muscle. Why there is a shrinkage of muscle? Due to heat. Easy. So fracture lines will be perpendicular to the axis of long bone. Look at this. This is a long bone, this is the axis of long bone, and the fracture lines are perpendicular to axis of long bone. Okay, this is called as street and avenue fracture. Okay, you can see the streets. Okay, this type of thing is there, right? So it's to some autopsy surgeon, this appeared like this. Okay, so he called it street and avenue fracture. So network of fractures seen over the cortex of long bones. Okay, cortex obviously, you can say outside part will be affected more, right? Look at this. This appears like this, right? This is the street. This is a cortex. Okay, it somewhat resembled this, so we called it street. Okay, street and avenue fracture. And the burnt bone will be grayish color. If there's a burning, you must have observed in some other serials like CID and all. Okay, CID is a must watch serial, I can say. Okay, I'm not vying for it, but it's a must watch. brittle or crumbling type of thing. Okay, brittle or crumbling type of texture. Okay, or you can say uh, consistency, and the color is basically grayish white color. Okay, so with that we completed our chapter heat and heat artifacts, right? And in the next session we will discuss about cold. Okay, cold injuries, hypothermia and frostbite. If you have any doubts, feel free to contact me on Instagram at okay, this is my Insta ID. So that's all. Thank you and good night.